Hello, my name is Daisha Richard, and I'm a third-year pharmacy student at Xavier University of Louisiana. The title of my presentation is The Impact of Hurricane Ida on Evacuation Behaviors and Access to Medical Care in Southeastern Louisiana during the COVID-19 pandemic. The increased frequency and intensity of hurricanes in recent years poses an unprecedented threat to the public health of communities living in coastal areas. Hurricanes are shown to cause and exacerbate multiple diseases with both acute and long-term health consequences. Frequent hurricanes disrupt health services and exacerbate underlying disparities in the southern region. A prior study conducted on hurricane-prone households in the southern United States found that COVID-19 concerns dominated risk perceptions and negatively impacted evacuation intentions. Recent work has also demonstrated associations between climate and transmission of vaccine-preventable diseases. Early in the pandemic, the state of Louisiana had one of the highest COVID case rates per capita in the nation. Based on the data from the Louisiana Department of Health, while African Americans make up 32% of the state population, they comprise over 70% of the COVID-19 deaths. Many residents who had died had multiple underlying conditions such as hypertension, diabetes, chronic kidney disease, and obesity, which are prevalent health disparities in the African American population. As many of you know, Hurricane Ida was a major hurricane that impacted the coast of Southeast Louisiana on the anniversary of Hurricane Katrina on August 29, 2021. Hurricane Ida was a very intense Category 4 hurricane, which sustained winds up to 130 miles per hour and winds gusts up to 160 miles per hour. The purpose of this study was to examine the impact of the 2021 Hurricane Ida on evacuation behaviors and access to medical care in southern Louisiana during the COVID-19 pandemic. This was a prospective cohort study among African Americans in southern Louisiana using a community-based participatory research approach. Surveys were conducted utilizing value relationships with community partners and faith organizations, clinics, pharmacies, and community organizations and barbershops. The main data set included 495 participants. The average age was 46 years old. About half of the participants were female and half male. Most had some college education or higher. A majority of the participants were publicly insured. Participants were originally surveyed in the spring of 2021 and were administered a post-survey in the fall of 2021. A total of 228 participants completed surveys from August 2021 to November 2021. Survey domains included evacuation behaviors, access to medical care, COVID-19 vaccinations, medications, COVID-19 testing from August 30th, 2021 through September 30th, 2021. Regarding displacement and access to general medical care, the majority of respondents, 67%, were displaced by Hurricane Ida and were displaced for 1 week or more. Most respondents did not require a doctor's visit. Of those requiring care, 55% were able to visit a doctor within the affected area. However, 25% of the respondents delayed visits. Most respondents did not seek medications from their pharmacies. Of those who required care, 54% were able to obtain their medications within the affected region. However, 22% of the respondents delayed prescription fills. Regarding access to COVID-19 specific medical care, of those respondents seeking COVID-19 testing and vaccinations, 64% and 50% respectively were able to obtain it within the affected region. 36% and 44% respectively delayed testing and vaccinations. In conclusion, majority of respondents surveyed were displaced and did not seek nor require medical care after the hurricane. Of those seeking care during the time frame, most were able to obtain it within the affected region. However, displaced residents sought care elsewhere and even delayed care due to the lack of access. These data and other collected within the parent study will be utilized to create a community-based pharmacist interventional model to address vaccine hesitancy and increase COVID-19 vaccine uptake within marginalized African American communities across the state of Louisiana. Here are my references, and thank you.